Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And hello everyone. Welcome to Nusaiba's first ever Haircare Talk organized by the Mahala Representative Committees of Mahala Nusaiba 2021-2022. Tonight, I, Fatima, will be your moderator. First of all, let me introduce our guest of honor tonight from Dr. Shah Clinic, Dr. Dina Khairia. Hello, doctor. How are you doing?
Hi, fine, thank you. Hi,
All
Fatima.
right. I'm so excited, and I'm sure all of you who are here tonight are also excited to learn and upgrade our knowledge today. But before we start, please do ask your family and friends to join our live session tonight, as they would be able to also grab the opportunity and chance to benefit from this talk, as well as maybe ask some questions during our Q&A session later. And if you are from IIU, please do fill in the attendance form if you have it, which will be shared in the chat box below. All right, everyone. I'm sure you're all waiting for this talk to start, but before that, let me just talk about a little bit about Dr. Dina's background. So, Dr. Dina actually acquired her medical degree in medicine and surgery from Zakwazik University in Egypt. She has pursued her medical aesthetic certification in 2018, majoring in lasers for pigmentation and rejuvenation, Botox, and dermal fillers. Upon completing her studies and research, she did her 2 years of compulsory housemanship training in Hospital Tawau, Sabah. She then continued her career as a medical officer for tuberculosis and leprosy unit at Sabah Health Department. And while serving in the government hospital, she was actively involved in community health talks organized by the department as a panel speaker. Along the way, Dr. Dina has found her flair in hair restoration and joined Dr. Shah Hair Clinic in 2018 till the present, and has performed quite a number of hair transplant procedures since then. Sharing what she learned and her know how technique, she was heavily involved in developing and training the clinical team in different aspects of hair transplants and procedures. So we can truly see how Dr. Dina is truly passionate about her career, and not just that, she's also passionate about the environmental issues, and in her free time she loves to travel and she likes to be adventurous and learn about the world. Right, so that is something that we can learn from Dr. Dina tonight. And without wasting any time, I'll pass the floor to you.
Thank you, Fatima. Hi, everybody. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. I'm Dr. Dina from Dr. Shah Hair Clinic. First of all, I would like to thank Muhala Nusaiba for this invitation. I'm very flattered. Basically, I'm working in a hair loss clinic. So most of the time, most of my patients are complaining of hair loss problems. But oftentimes, we also get a lot of questions asking, for example, which shampoo should I use for my hair, or which conditioner should I use, which hair care routine is suitable for my hair, things like that. So today, I would just like to share some tips and some guidance to help you all find or become your own hair expert. Okay, so we shall start. So next slide. Okay. So basically, hair care is very important. Why? Because not only because a good hair it represents our health, it presents our self-confidence and self-esteem. So having a healthy hair allows us to look our best and ensure our hair and scalp are healthy. And the look of hair is important to many and has a significant impact on our self-confidence and health self-esteem lah. Okay, next please. So you can see the difference between a good-looking hair versus hair that's frizzy and dull appearance. Okay, those who have a healthy hair, it represents their self-confidence and self-esteem. Okay, next please. Okay, basically hair care routine is almost similar. Is similar like your skincare routine. So not everybody, not there are not there are no specific hair care routine that will suit everybody. Okay, because we are born with different skin types. We are born with different scalp types. So some have oily hair, some have drier hair or drier skin. Okay, depends on the activity of your sebaceous or your oil glands. Okay, however, once you found the right routine for you, then you should stay with that or you should stick with that routine. Okay, however, to find the right routine for you, there should be some trial and error. So that can seem to be a little daunting, especially nowadays. We have a lot of options in the market. There are a lot of hair care brands. There are a lot of shampoo brands, things like that. Okay, so you should basically a good the right hair care routine is it needs some trial and error lah. But I'll give you some tips on how to find the right routine for you. Okay, next please. Basically, how to have healthy hair. You get healthy hair if you get the right routine for you. So the first step is you have to know, you have to identify your own scalp and hair type. Okay, next, basically, like skin, scalp is also skin. So basically, skin it contains oil glands or glands that producing sebum. So some people who have some who have increased amount of sebaceous gland in the skin, increased activity of the sebum production, they will tend to have oilier scalp or oilier skin type. Okay, compared to those who have reduced number of sebaceous gland or reduced activity of the sebum production glands, then they tend to have a dry skin type. So how to know whether you are oily or you are dry? It depends on usually my patient will ask whether their scalp is oily or dry or which scalp type are there. So usually for those who have oily scalp, right, they tend to shampoo every day. If they're not shampoo every day, they will find their scalp very itchy, very oily. The hair will be sticky and greasy. So those are the signs that you might have an oily scalp or oily hair. Okay, for those who have drier scalp or drier hair, that tends to when they will have some problems wherein if they shampoo every day, they will find their hair will be very frizzy, very dry, and almost like they will develop some flaky skins on the scalp. So those might be the signs that you have drier scalp. But for those who have normal skin, they are okay with shampooing every day. They don't develop oiliness, they don't develop dryness. So that might be a sign that you have a normal scalp or normal hair type. Um, Sometimes people, whether you are oily or dry or normal, you might have the problem with dandruff. Okay, basically dandruff can be caused due to increased proliferation or increased numbers of there's one fungal yeast. It's a normal flora called Malassezia on the scalp. If it is flourish, then it can cause dandruff lah. Okay, whether you're oily or dry. Okay, next please. Those are the scalp type. For hair types, basically, you're born with that genetic lah. So some people they are born with straight hair, or some wavy, curly or kinky. It depends on your genetics. You got your hereditary type. Some might have different porosity of the hair. So porosity means the openness of your cuticle. So those who have low porosity, they tend to they when those who have low porosity, meaning they tend to not lose moisture from the hair easily easily as compared to those who have high porosity. Hair porosity means your cuticles are open, so it meaning your hair tends to lose its hydration and moisture. So for those who have high porosity, it's very important for them to use conditioner lah, to maintain the hair hydration and nourishment. Okay, next. So you have to know the scalp, your scalp and hair types. Okay, next slide, please. The second step is to know whether your hair, if you have any history of bleaching your hair, dyeing your hair, or any chemically processed procedures. Okay, basically, okay, next. Um, for hair that has been bleached, dyed, or if you done any chemical procedures like straightening or dyeing your hair or do the relaxing, then it means that your cuticles are, there's high risk of your cuticles to be damaged. So hence you need extra nourishment to your hair shaft. If not, you'll lead to damage of the cuticles of the hair lah. Okay. And then people who has dyed their hair, usually we advise, if they want to maintain the color, we will advise not to wash more, as frequent, not to wash every day. If not, it will cause premature color fading, will cause the hair dye to subside faster lah. Okay, next please. Okay, after you identify your scalp type, and then your hair types and whether your hair has been exposed to any chemical procedures, then you can find the right shampoo. Okay, uh, but in the markets nowadays, you see a lot of brands, especially anywhere in Guardian or in Watson, a lot of brands. So some people might find them confusing, or some people might find it's quite hard to find the right shampoo for them. How to choose the right shampoo for you is, sorry, next slide, please. Okay, sorry, I'll just quickly brief through what shampoo actually does. So you can actually see shampoo uh, as in like a skin cleanser. What shampoo does is just to cleanse the scalp. That's the main function of shampoo lah, basically. Okay, a decent shampoo, a good shampoo is basically the shampoo that can clean your scalp. Cleaning your scalp meaning it can remove all the oils, the excess oils, the debris, the dead skin cells, and the product residue. For example, if it's somebody who likes to use hairspray or hair wax, things like that can leave product residue, then you need to find a good shampoo that can clean all of that, all of those residues lah. Okay, however, the thing about shampoo is they need a balance. What shampoo does is when it cleans, it will remove all the natural oils as well. So if there is excess removal of those oils, it will cause the hair to be frizzy and dry. So there should be a balance, which is why it's very important for you to identify first whether you are oily scalp, oily hair, or you are dry lah. Okay, to get that balance. Okay, next please. So good shampoo basically it will remove all those dandruff, it will remove all those dead skin cells, any product residue. Okay, so a good, clean, healthy scalp should look like that picture, the right one. Okay, next please. Okay, finding the right shampoo basically is the using the shampoo that is right and suitable for your scalp and hair type. Okay, next.
Doctor, before you move
Hmm?
on, I would just
Hmm?
like to ask lah.
Hmm?
So since you say like the most important thing is to find the shampoo because it is basically like something that we like facial cleanser. So
Hmm?
do you think it's already enough for us to find the shampoo? Like, do we need other hair products to also assist our hair or scalp problems?
Yeah, it depends. Basic product that you need is shampoo and conditioner. But you can find in the market nowadays, they have a lot of hair treatments, leave-in treatments, things like that. Those are optional. It depends on your hair as well. For those who have dry, damaged hair, or hair that if you find you doing chemical procedures on your hair more frequently, then absolutely you need something uh, leave-on treatments so that it can maintain your scalp, your hair hydration, things like that. But for basic thing, you need the basic thing you need is actually shampoo and conditioner.
You
Uh,
must have the two of it.
those two, yeah.
Mm.
So today I'll just focus on those two, like shampoo and conditioner. The rest is optional. Like if you want to do any treatments, like some people they might go extra, they do keratin treatments in the salon. Those are good for your hair shaft, but those are extras lah.
Mm.
Mm. Okay, so I continue. So actually, um, the main thing a good shampoo does is it should cleanse your scalp well. Okay, so you have to look for shampoos to set your hair up so that it is clean and ready to receive a benefit agent from another product. For example, any rinse off conditioner, or if you want to use any serum or toner, those are optionals lah. Okay, it is, however, it is very easy to formulate a shampoo that will remove dirt, but the hair has it all the sebum removed is dull in appearance, coarse to touch, and subject to static electricity and more difficult to style. So that's the problem about shampoo. Shampoo, what it does is it clean the scalp, it remove the residues, the dead skin cell, and all. However, it also remove the our natural oils.
Mm.
So
Very drying.
so after shampoo, you'll find your hair to be a bit frizzy, a bit dry, things like that. Okay. However, different shampoo has different detergent types, and different detergents has different cleansing ability. If the shampoo has high detergent ability, then if the detergent is strong, then it will leave um, the hair becomes dry. However, it is a good it has a good cleansing ability if the detergent is strong lah. So that's the balance that I mentioned. You have to find the right detergent or the right shampoo for you. Okay, next please. So I'll explain about the detergents next. So basically what shampoos contain, main ingredients is the detergent. Detergents, you see it as a soap lah. Mainly the detergent is for cleansing. And then nowadays modern shampoo, since they don't want the shampoo to be drying too much, so most company nowadays they add in conditioners into the shampoo so that the hair will be more manageable, and the rest of the ingredients inside the shampoo usually is ingredients that will add in stability, presentability, and marketability of the product. Okay, next. Okay, so inside a shampoo ingredients, there are few ingredients. Basically, the main ingredients inside a shampoo is the detergents, the soap, the ones that cleanse. The rest is, for example, conditioners to moisturize, and then the others are supportive ingredients, for example, thickeners, pH adjusters, fragrance, preservative, things like that. Okay, so the first okay, for example, this Head and Shoulder ingredients, if you look through the ingredient list at the back, you'll find this list. For example, the main surfactant, the main detergent, sodium lauryl sulfate, things like that. And there will be, sometimes they will add in another few types of detergents as well. And then the rest are the other supportive ingredients lah. Okay, next. I would just like to train you guys to be familiar with what detergent is inside your shampoo, because it's the detergent that will basically, the right shampoo is when you find the right detergent for you. Okay, so just be familiar with what detergents is inside your shampoo. For example, like this Head and Shoulder shampoo, the main detergent is usually they will write down the detergents on the first few ingredient list. You can see these two shampoo, the first ingredient is water followed by sodium lauryl sulfate, so that's the detergent, the first detergent. And then the second is for example, like this Pantene shampoo, is the third ingredient is cocamidopropyl butane, that's the secondary detergent, and then the rest is just the supportive ingredients. Okay, so next slide please. Okay, what is detergent? Detergent, you can see detergent as a soap. Basically, it functions in cleansing your scalp. A shampoo usually contains synthetic detergents or surfactants as primary cleansers. And a detergent or surfactant is actually amphiphilic, meaning it contains both lipophilic and hydrophilic sites. Okay, lipophilic means oil attracting, and hydrophilic means water attracting. Usually the head is hydrophilic and the body and tail is lipophilic. The lipophilic sides is the one that will help to bind sebum and oily dirt, while hydrophilic end binds to water, allowing removal of the sebum while washing with water. Okay, next. Next slide, please. Okay, for detergents, mainly there are 5 categories of shampoo detergents. So this is what I mentioned. The right shampoo is when you find the right detergent for you, or when you choose the right detergent for your hair or for your scalp type. If that shampoo is intended for oily hair, then it should contain a detergent with strong sebum removal qualities. For example, anionic detergents. I'll explain the list after this. But if the shampoo intended for drier hair or for wavy hair, then they need a milder detergents that can reduce sebum removal and retain natural hair oils to avoid excess drying of the hair after shampoo lah. Okay, so nowadays modern shampoo contain a mixture of surfactants, meaning more than one type of surfactants or detergents can be included into the shampoo to provide optimum cleaning levels according to hair type requirements. Either it's normal, oily, dye, perm, coloured or damaged hair. The detergent listed first denotes primary cleanser, which is the highest concentration, and the detergent listed second is the secondary cleanser, designed to offset the shortcomings of the primary detergent. Okay, next please. So basically there are 5 main types of detergents. Number 1 is what we call anionic detergents. So anionic detergents, for example, are like sodium lauryl sulfates, lauryl sulfate. So sometimes nowadays you'll find some controversies like you might find some shampoo that state, oh, no SLS, no SLES. So SLS basically is lauryl sulfate, sodium lauryl sulfates. SLES is lauryl sulfates. So you find sometimes you'll find, for example, mostly like organic shampoo or shampoo for sensitive scalp type, they will state in the shampoo like no SLS, SLES. So those actually denotes the anionic detergents. So anionic detergents actually is a very good for cleansing and deep cleansing the scalp. So usually shampoos catered for oily hair contain anionic detergents. And then the rest of the other detergents are like cationic, non-ionic, amphoterics, and natural surfactants. So the other detergents like cationic, non-ionic, amphoterics, usually it is milder compared to anionic detergents. Hence, they are more suitable for those who have dry or damaged hair, or for those who are dyeing their hair, or did relaxing, or any uh, did relaxing on the, or any chemical procedures on the hair. So those milder detergents might be more suitable for them lah. Amphoteric detergents, usually you'll find these ingredients in baby shampoo, because amphoteric is non-irritating to the eyes and mild cleansing lah. Okay. Okay, next slide please. So anionic detergents is the you'll see this is the main ingredient or the main detergent in the market. There are a few types of examples of anionic detergents. The most popular one is lauryl sulfates, or what we call is also known as SLS. It's a popular primary and excellent cleanser. It produces rich foam and easily rinse, and usually you'll find this SLS in oily hair because it's a very excellent in its cleansing ability lah. However, after using shampoo containing lauryl sulfate, you will find the hair becomes harsh and rough. So it's very important for you to use conditioner after using any shampoo with SLS. Um, but the main controversy about SLS is actually the problem with SLS, which is too strong and too
Mm.
harsh. So some people might be sensitive to it. But besides that, some people might get scalp irritation as well. But besides scalp irritation or having reaction to it, or for those who have no problems of using shampoo or after using shampoo containing SLS and then don't get any skin reaction, then actually it's quite safe for them. It's very rare for SLS to cause scalp irritation. However, for those who have sensitive scalp or sensitive skin, should avoid SLS just to be safe lah. Okay. The second ingredient is lauryl sulfates, or what we call SLES, is also has good cleansing ability. However, unlike SLS or lauryl sulfate, this lauryl sulfates or SLES is much gentler and doesn't strip the epidermis of any excess moisture, so it will leave the hair soft, smooth, and nourished. So I open the basically I just open a Watson website, and then I find that in Malaysia most of shampoo nowadays they don't contain SLS much anymore, but they contain mostly Laurus or SLES lah. So if you find if you can check your shampoo ingredients, I think most of it will contain SLES or lauryl sulfates. It's more gentler than SLS, but it still give good cleansing ability. The third anionic detergents are sarcosines. Sarcosine usually it comes as a secondary detergents. However, why? Because it does not remove the sebum well, as in SLS and SLES. So usually it comes as a secondary detergents. The fourth types of anionic detergents is sulfosuccinates. However, sulfosuccinates might cause drying to the hair as well. So usually you'll find these sulfosuccinates in for those who for oily hair shampoo. Okay, next please. Next slide please. Next. Okay, other detergents for example, cation, non-ionic, amphoteric, natural detergents. So these detergents actually has milder cleansing ability compared to anionic detergents as in SLS and SLES. However, since they give mild cleansing ability, they might be more suitable for those who have dry and damaged hair, or for those who have chemically exposed hair lah. Okay, so you might find these detergents in shampoos for dry and damaged hair or for color treated hair, things like that. Nowadays, there increase or rise in what we call organic shampoo, which contain natural detergents. So we actually have natural detergents that contain surfactants, natural surfactants. For example, like this fruit pulp of sapinders, ivy, soap bark, things like that. However, in this, they are very easy to lather to the hair, but then they don't have good cleansing ability compared to anionic detergents. So not everybody will be suitable to use natural detergents. So for example, if you have oily hair or you have dandruff hair, natural detergents will be enough for you. Okay, so not every organic shampoo will be suitable for you. Okay, next slide please. Okay, so who should use which shampoo? Next. So basically you'll find in one specific shampoo brand, there will be few ranges of that brand. For example, there will be a range for normal hair, for oily hair, for dry and damaged hair, for deep cleansing, baby shampoo, things like that. Okay, okay, next slide. So who should use normal hair shampoo? So normal hair shampoo is suitable for those who have for example, chemically untouched hair. They haven't dyed their hair, they haven't exposed their hair to any chemical procedures, they have moderate sebum. For example, if they shampoo every day, no problem as well. They shampoo every 2 or 3 days, still their hair is okay. Then that could be a sign that you have a normal scalp. Okay, so you can use a normal hair shampoo, but the primary detergent in normal hair shampoo usually is sodium lauryl sulfate or SLES. So SLES it provides a good cleansing ability with minimal conditioning. Uh, so example of normal hair shampoo is next slide please. This. So this I don't have any conflict of interest with this product. I'm not sponsored. Basically, this is just the list of shampoos that I've found in Watson website. I looked through the ingredients, and these are the shampoo that contain sodium lauryl sulfate. And most of these shampoo as well, they contain conditioning agents, conditioners. So this shampoo might be suitable for those who have normal hair. Okay, next please. For those who have drier hair, they can you find that shampoo for dry hair is suitable for those who have dry and damaged hair, or have gone chemical treatments or any harsh styling procedures. So usually this
Sorry for the.
okay, it's okay. So for dry hair shampoo, usually it will contain cationic or amphoteric detergents due to its mild cleansing. So when it is mild, then it won't remove excessive natural hair oils, and also contain good conditioning ability lah. Okay, so example of this dry hair shampoo are like this. Uh, Basically, you have to look the ingredients at the back, and then see the main detergents. So for dry hair shampoo, it should contain ionic or amphoteric detergents lah. Okay. Okay, next slide please. For those who have oily hair, then they can look around oily hair shampoo. So oily hair people, they will have a problem with overactive sebaceous glands, sebum glands. So they will find if they don't wash their hair every day, their hair will become very oily and greasy and sticky. So they need to use a shampoo specifically for oily hair. So the main detergent for oily hair is SLS, lauryl sulfates or sulfosaccinates, which provides good cleansing ability and mild conditioning. And usually in oily hair shampoo, they will add on secondary detergent as well to help in removing the excess oils lah. Okay, so example of these are the shampoos that I find containing SLS with secondary detergents. So you can find all this product in Watson. You'll find also in baby hair shampoo, it will contain amphoteric group detergents. So basically, baby they have limited sebum, so they cannot use a strong or shampoo containing strong detergents or anionic detergents. So they need to use a milder type of shampoo containing amphoteric group detergents lah. And also usually in baby hair shampoo with amphoteric group detergents, since these detergents actually it won't cause stinging to the eyes. However, you still need to be cautious lah. Okay, don't let the detergents or the shampoo touch the eyes of the baby or your own eyes, because it still can cause irritation. Okay, so these are the baby shampoo that will contain amphoteric detergents. Okay, next slide please. And anti-dandruff shampoo. So basically, dandruff is due to increased activity of this Malassezia yeast. It's a normal flora on the scalp, basically. But however, it will be flourish when the scalp is oily. Basically, this yeast, this fungal, it eats on that skin cell and oil. So if you leave your hair too greasy or too oily, or if you not shampoo frequently, especially for those who have oily hair, they will tend to get dandruff due to this yeast become flourish lah. Okay, so however, when this yeast or this fungal increase, it will cause inflammation. That's why it will lead to itchiness, flaky skin, and dry redness. If worse, it becomes seborrheic dermatitis. So usually most anti-dandruff shampoo, it contains antifungal agent. For example, you find anti-dandruff shampoo will have active ingredients, for example, zinc, ZPT, zinc, pyrithione. I think this one you'll find in clear shampoo or head and shoulder shampoo. And usually anti-dandruff shampoo will contain an ionic detergent as their primary surfactant or primary detergents lah, to remove excess oils and dandruff. So they need a good detergents with good cleansing ability. So these are the shampoos that I find contain active ingredients as in ZPT, zinc as an antifungal property, and using anionic detergents as their primary detergents. Okay, next slide. There are also medicated hair shampoo that you can find in the pharmacy, or it might need prescription as well. So basically, medicated hair shampoo is catered for those who have scalp problems, for example, seborrheic dermatitis, psoriasis, bacterial or fungal infection, depends on your doctor. Basically, in addition to regular cleansers, this medicated hair shampoo, it contains certain active ingredients lah. For example, tar for psoriasis, steroids, salicylic acid, ZPT, sulfur, things like that. Okay, so you can find this medicated shampoo in the pharmacy or in the clinics. Okay, so usually people ask, okay, how frequent should I wash my hair? Because you find the media, social media, they say, some people will say, oh, don't wash your hair because it will damage
Yeah,
your
become very
scalp.
dry.
Yeah, become dry. Or some might even say, if you're washing too much, it will cause hair loss or hair fall. Basically, that is not true. Um, Shampoo has nothing to do with hair loss. It's just that the thing about shampoo is if you're using a strong detergent containing shampoo, then definitely will cause dryness to your hair if you have dry hair or dry scalp type lah. But if you have like very oily hair, then definitely you can use any shampoo catered for oily hair that contain anionic detergents, and there's no harm of you uh, shampoo every day. So shampooing every day or how frequent you depends on your scalp type. For example, if you have oily scalp, very oily, then definitely you need to shampoo every day or twice a day. It depends lah. Okay, once you find your scalp or your hair becomes oily, then it's a sign that you need to wash your hair. If not, it will lead to dandruff and itchiness and redness lah. Okay, but if you find that your hair becomes oily like after few days or after 2 days or 3 days, then that's a sign that you need to wash your hair every 2 or 3 days. It depends on your scalp type. It depends on your sebum production lah. Basically, there is no upper limit of frequency provided regular conditioner is used. Yeah. So basically, the thing about shampoo, whenever you shampoo, it will remove the natural oils. So with either you use a shampoo containing milder detergents, or uh, if your scalp is oily, then you wash your hair every day with the right shampoo. However, after shampoo, you need to use conditioner. But frequent hair shampoo does not cause hair loss. If you read anywhere they say frequent shampoo causing hair loss or baldness, that's not true. So don't worry. Okay.
Then, doctor, because like you said, right, the shampoo
Mm-hmm.
is totally depending on this condition of our scalp.
Mm-hmm.
Then, do you think that every individual should, especially for us who wears hijab, because it
Mm-hmm.
really depends on the temperature and then the amount, the intensity of our activities. Do we need different types of shampoos depending on how much we sweat? If that makes
Um,
sense.
for those who wears hijab, or for those people who usually sweats a lot, I would suggest a shampoo with good detergent. For example, anionic detergents that contain good cleansing ability. Um, for Nowadays, you'll find some shampoo targeting hijabis. But if you look, the ingredient actually is just a normal daily shampoo. It's just the marketing technique lah. Basically, you just need to know the detergent. If you sweat a lot, then definitely you need some shampoo that have good cleansing ability to remove the sweats and any residues or debris. So those who sweat a lot needs to suggest to use shampoo containing an ionic detergent lah. Um, for example, SLES shampoo, things like that.
Is it true that
Mm.
for us women, like since we have our menstrual cycle, some
Mm.
people claim that when they are experiencing their PMS or
Mm.
during their menstrual cycle, they
Mm.
say that the hormonal changes causes a lot of
Hair fall.
sebum there's many conditions for them. So
Or could
um,
be.
yeah, so
Um,
how do people cater to that? Is it something that they should do change internally or change their shampoo or
they don't need to change their shampoo. It's just that actually our hair, it grows in cycle. So there are tons of factors that can affect our hair cycle.
I
So
see.
basically,
Okay.
it's not actually normal to have your hair fall every day. Because our hair, it grows in cycle, so it's normal to have every day to lose about 50 to 100 hair shedding every day. That's normal,
Mm.
but that amount can increase due to many factors. Can be caused by hormonal. So if you say can menstrual cycles or can affecting hair loss, maybe because especially those who are pregnant mothers after they gave
Mm.
birth due to change in the hormones, especially during your menstrual cycle, right? So the estrogen levels, the LHFS, there are many hormones that affecting you, being affected during menstrual cycle. So those can affect the hair growth cycle as well.
Mm.
So it might cause sudden increase in hair fall, but usually that's just temporary. So you don't need to change any shampoo.
I see. Okay.
Yeah,
Okay.
even if there's any hair loss problem, changing shampoo won't help. There's a specific treatment lah. Mm.
Okay. That's good to
Okay.
hear. No need to buy different shampoos.
Yeah, I don't need. Basically, shampoo is just a cleanser. So just see your shampoo as a skin cleanser lah, just to remove the debris. If you see like nowadays also you find there's a lot of anti hair loss shampoo.
Mm.
Um, does it work? I don't think so, because shampoo basically you just apply it for a few minutes on the hair and then you rinse it off. So it's very unlikely for those ingredients to give any benefit in that short amount of time. Mm. So I don't think so. But there's a lot of debates on that. Okay, so let's continue. Next slide, please. Okay, so the thing about shampoo, right? When you, why after shampoo the hair becomes a bit frizzy is that when after shampoo, due to the negative charge of the shampoo, it will slightly raise the cuticle. So you'll find that after shampoo, your hair will be drier and
Mm.
frizzy because of the charge, the negative charge of the surfactant inside the shampoo lah. Okay, which is why to reduce the swelling of the cuticles, then you should use conditioner to smooth the cuticle back. Okay. Sorry, next slide, please.
Oh, by the way,
Mm.
I think we will have a short 5 minute break for now.
Okay, sure.
So we'll see you guys. Don't go anywhere. We'll come back after the short break. Stay tuned.
Okay.
Just took a little bit of work and a whole lot of love. Mwah. Are you ready to do this? All right, here we go. See? Now, wasn't that easy? See? Now, wasn't that easy? All it takes is some confidence and a willingness to get started. And even though I'm not there, I'll guide you through this. I want to thank my very special assistant, my daughter Zuri, for helping me with today's vlog, like always. And remember, the road ahead might look rough, but you can make the journey with a little bit of work and a whole lot of love. Mwah. Are you ready to do this? All right, here we go. First, we want to moisturize these beautiful thick curls with a leave-in conditioner, which will also help detangle the kinks. Now, part all your hair into sections and clip it away. You're doing an amazing job. Yay, you did it! That was so much fun. I knew you could do it.
Hello, everyone. Welcome back. Truly sorry for some technical issues just now, but Alhamdulillah, we are back. So, before we start, just a little bit recap on what we have learned from Dr. Dina for the past almost an hour just now. Basically, it is very, very important for us to know our hair type, our scalp type, just like when we want to choose our skincare, right? We need to know, is it oily, is it dry, or normal? Only then we will be able to find the right shampoo for us. And not only the shampoo, we must have conditioner together because, as mentioned, some of the detergent soap agents, cleansing agents in these shampoos might be a little bit harsh, or it is just very drying, and therefore it needs some sort of hydration from a conditioner to keep our hair healthy. And I'm sure we want to know what is the next step on finding the right conditioner. And with that, please, you can continue, Dr. Gina.
Okay, hi everybody. After finding or choosing the right shampoo for you, then the next step is to find the right conditioner for you. But conditioner is more straightforward. Basically, what conditioner do, you can simply see conditioner as in skin moisturizer. What conditioner does, the main primary goal is for hair conditioner is to improve manageability of the hair by reducing the static electricity. Okay. Besides that, conditioner also will help to decrease friction between hair shafts through a smoother cuticle surface, and also improve hair shine by increasing adherence of the cuticular scale to the hair shaft. Okay, next slide please. So what happens after shampoo? As I mentioned, because of the charge of the surfactant inside the shampoo, it will cause your cuticle to open or raise or swollen. So hence, after shampoo, you'll find your hair become frizzy or become dry. So that's why after shampoo, you need to use a conditioner so that the conditioner can smooth down the cuticle. Causing when the cuticle is smooth down, then it will be easy to manage. Then the hair will be less frizzy and less drier and adds on shine to the hair as well. Okay, next slide. Basically, in conditioner, actually there's surfactant in conditioner as well, but the conditioner as well, but the surfactant in conditioner is different from shampoo. The difference between the surfactants in shampoo and conditioner, basically in shampoo, the surfactant is shorter in length and easily to wash off. However, it will be longer in length in conditioner, and the surfactant in conditioner will deposit it into the hair shaft, and the surfactant in shampoo is negatively charged. So when the shampoo surfactant is negatively charged, then it will cause swelling or raising the cuticle surface lah. Okay. However, the surfactant inside the conditioner is positively charged. So it will correct the negative charge from shampooing and helps to smooth the cuticle down. Okay, next slide. So what happens is, you see after shampoo, the cuticle will be open. Then, but after or with conditioner, it will help to smooth down and close the cuticle, causing the hair to be less frizzy and easier to manage and as on shine. Okay, next slide, please. Okay, so this might happen. This might be the differences after shampoo, without conditioner and with conditioner. Okay, next slide. So you'll find the market nowadays there are many types of conditioners. Mainly there are three types of conditioners. It can comes in a rinse through conditioner, meaning after shampoo you just apply for a few minutes and then you can rinse the conditioner. So usually rinse through conditioner, what it does is it will cause the cuticle, deposits moisture and sometimes protein to the cuticle layer of the hair shaft. Okay. However, you can find also there will be deep conditioner, meaning it targets to treatment and repair of the hair shaft. What it does is it will swell the cuticles, replenish the protein and restore strength of the hair shaft. Okay, usually deep conditioning, you need to apply deep conditioner for a longer period. Some deep conditioner you need to apply about 30 minutes, some even up to 1 hour
Wow.
or few hours. So you'll find in the salon, what they do, for example, hair mask, things like that, is actually a deep conditioner. So you need to apply it in a longer period of time lah. Okay. There are also leave-in conditioner. Basically, you just leave. You don't need rinsing after applying the conditioner. So just leave it onto the hair. So what it does is it will cause the cuticle and protects the hair. So who needs? So how to choose the right conditioner? Basically, next slide please. For those who have oily or greasy hair, some people with oily or greasy hair, they tend to not use conditioner.
Mm.
If your hair is too oily, then you may skip conditioner. Just rely on your natural hair oils lah. However, you'll find most people, they have oily scalp, but their hair is dry, or the
Yeah.
ends of the hairs are dry. So for those people who have those combination oily scalp, then they need to use a oily hair shampoo. But if they also have dry hair, then they need to use a conditioner. But use a conditioner that has label, for example, light conditioner, balancing conditioner, or volumizing conditioner. But avoid conditioner from touching your scalp, because the conditioner can cause excessive oil. It can cause your scalp to be too oily. It can block the
Mm.
sebum as well, so it can cause irritation and scalp pimples. Okay, so these are certain conditioners that I find might be suitable for those who have oily or greasy hair.
Then doctor, just now you
Mm,
mentioned since like conditioners aren't supposed to touch the scalp,
mm.
how much like should the conditioner cover our hair? Like should it cover only the lower part? Because I think that's the only part that doesn't
Yeah,
touch the scalp.
yeah,
So
that
you
one,
don't
or
have
you
to touch
just
all.
if you have like just apply on your hair shaft. If you have shorter hair, then you can pump the conditioner onto your palm and just apply on the outer surface of your hair.
I
Avoid
see.
touching. Avoid the conditioner from touching your scalp lah. Uh, there's no harm with that, but it can make the scalp to be oily. Mm.
Mm.
For those who have dry, damaged, frizzy hair, then you have to avoid volumizing or strengthening conditioner labels with volumizing or strengthening conditioner, but choose a conditioner that provides a good moisture and hydration. So find a conditioner that will increase moisture and hydration to your hair. So find a label that state like moisture conditioner, hydration, or balancing conditioner. Mm. So these are few conditioners that might be suitable for those who have dry damaged hair. Next slide, please. For those who have very damaged or brittle hair, for example, those who frequently do chemical procedures on their hair, so they need to use a stronger conditioner. Look for labels that promote repair, control, or control freeze, or good for those who uh, usually exposed to heat damage. Okay,
Mm. Hair
and
dryer.
then or hair dryer, things like that, or frequently do like hair relaxing, firming, things like that. So you need to use a conditioner that's stronger. So look for label that promotes repair or control freeze lah. Okay, usually for those who have very dry, very damaged and brittle hair, they are advisable to do deep conditioning as well. You can do it like a few times per month, 1 or 4 times per month. It depends, so that your hair damage can be reduced. Mm. Okay, so these are a few conditioners that might be suitable for them. Next slide, please. Okay, I think the basic thing is just to use the right shampoo. So you need to be familiar with the detergents inside your shampoo. Okay, if you have oily hair, then use detergents that contain anionic detergents lah. If your hair is dry, damaged, or chemically treated hair, then use a shampoo that is containing milder detergents. And after shampoo, use a conditioner so that your hair will be less frizzy, less drying, things like that. Okay. The last step is I would like each of us to detect early signs of hair loss. because hair loss is actually is preventable and treatable if we diagnose them early lah. Okay. So next slide, please. So some people thought that hair fall is not normal, but
Mm.
actually it's normal to have hair fall because our hair it grows in cycle. So each strands of hair, right, it will stay like that for 2 to 6 years, and then it will fall. It will fall. It needs to fall in order to allow new hair to grow. Okay, so every day you'll find normally about 50 or 150 hair fall every day. But don't worry, because all of those hair will be replaced with new hair. So what we call baby hair lah. Okay, so
Mm.
all hair that you find after if you have any hair shedding after combing or after shampooing, those hair is actually hair that needs replacement. So don't
I
worry,
see.
those hair shedding will be replaced lah. Okay, but when you need to worry is next slide, please. So there are few signs that might indicate you might have hair loss. Okay, so what are the abnormal hair loss signs? Number one is if you find your hairline is receding, or if you find your forehead is widening, then that might be a sign of hair loss. Or if there is excessive hair shedding meaning um, your hair fall is more than 150 or 200 hairs per day. But how to know is basically um, we're not familiar with quantifying our hair every day basically.
Mm.
So what I tell my patient is if you find your hair increase in the amount suddenly, like double or triple, then that could be a sign of abnormal hair loss. Mm. Number three, if you find that your hair gets thinner, or there's area where the density is reduced, then it could be a sign of abnormal hair loss as well. Or some people might get bald patches. For
Mm.
example, in alopecia areata, so those are the sign of abnormal hair loss as well lah. So if you have this problem, it will be best if you visit any clinics, not necessarily hair loss clinic. You can visit any GP clinic as well to get advice from professionals lah. Mm. Okay, next slide. So basically, hair loss can be treated easily if they are diagnosed early, but if you let your hair progress until advanced stage, then the treatment could be difficult. Okay, because the thing about hair loss is uh, once the hair follicle shrink, or once the hair roots is not there, that will be irreversible. You won't be able to produce new hair roots. So it will be permanent. So if you're bald, it will be permanent if you don't treat it early. So early treatment of hair loss basically is to preserve your hair roots and prevent the hair roots from dying lah basically, or from
Mm.
disappearing from your scalp. Okay, the only treatment if you want to add on new hair roots on the certain area of your scalp, the only treatment is to do hair transplant, unfortunately. Okay, next slide, please. So this is our clinic. So if you have any hair loss problem, or if you just or any scalp problems, or you want to identify uh, or any kind of hair problems at all, you can visit us in our clinic uh, for you can do scalp examination and consultation lah. I think next slide, please. These are my references, and I think that's all. That's my presentation today. Thank you.
All right, thank you so much, Dr. Gina, for that amazing and very detailed explanation on how can we find the right shampoo and conditioner for our hairs. And I think it's very important for us to know what are inside the shampoo, because most often
Hmm.
people just only go for the brands or
Yeah,
something that is only
exactly.
recommended, but then they
Hmm.
have no idea what is in the shampoo. And
Hmm.
sometimes people just say a certain ingredients are bad, but it is very important for us to understand how it functions and how it helps, instead of just thinking just because it's there, it's bad. But as mentioned by Dr. Dina, something that is organic or natural is not necessarily the best and would actually maybe solve the problem that you need to cater to. All right, so I think as we can both see, there are a lot of questions from our participants tonight. Right now, we are in the Q&A session. So to all our viewers, if you do have any questions you want to ask Dr. Dina right now, you can just write them down in the chat box, and our committee teams will gladly forward those questions to us. All right, so now I think we can. All right. Okay, so we have one question from Sister Alia. Is it true that a straight and curly hair should use different products based on the type of hair? So
Yes, cool.
I think what Alia is trying to say here is, does maybe the shampoos that we usually find
Mm.
in drugstores, do they work for both of these hair types?
Yes. Usually, for those who have curly hair, their hair tends to be more frizzy compared to those who have straight hair. So usually, for those who have curly hair, wavy hair, a shampoo that's containing milder detergent might be more suitable than for them compared to for those who have straighter hair, because
Mm.
curly hair, if they use a shampoo containing strong detergents, then their hair will be more frizzy. So stronger detergents, shampoo that's containing strong detergents, for example, anionic, SLS, SLES,
Mm-mm.
might not be suitable for those who have curly hair, because it will cause their hair to be more frizzy. Mm, that's all lah. But then there's it's not like a straight no. You can use actually any shampoo for straight hair as well, but you have to mind that after shampoo you need to use a good conditioner that will tame the frizzy down lah, or to reduce the moisture loss from shampoo. Mm. So usually that's the difference between curly hair shampoo and straight hair shampoo, is the detergents. In curly hair shampoo, the detergents tends to be milder. Mm.
All right, so Sister Alia, you can
Mm.
find any shampoo out there for whatever hair type you have. All right, so now next we have from Sister Sarah. Is it better to wash our hair every day if we are dealing with dandruff, or just wait it 2 or 3 times a week?
My suggestions, if you have dandruff, you have to shampoo every day. Um, uh, Basically, if you have dandruff problems and you have oily scalp, then you have to wash every day. But if you have a dandruff, you have dandruff problem, but your scalp tends to be drier, then you can shampoo every day, but use a shampoo that contain milder detergents. Usually for those who have dandruff, we sometimes we prescribe them with anti-dandruff shampoo, with medicated shampoo, or any antifungal shampoo for them to use in alternate days and combine with their daily shampoo. So if you have dandruff and dry hair, you can actually combine daily shampoo with milder detergents, and at the same time use a medicated shampoo every other day or every 2 or 3 days. If you have oily scalp, definitely you have to shampoo every day.
All right, thank you, Sister Sarah. Hope that answers your question. Next, we have from Sister Nurain Batrisha. How to differentiate between dry flakes and dandruff?
So basically, dandruff is actually dead skin cells. So dandruff and dry flax is actually the same.
Mm.
It's just dandruff is just dead skin cells lah. It's just that there's a difference between dandruff and fungal infection. So that one, by symptoms, is almost the same. You have redness, itchiness, oiliness as well. Some people we might have to differentiate dandruff and seborrheic dermatitis as well. But all of these, we need to do proper scalp examination. There's a device for that to scan the scalp. Uh, to get the proper diagnosis. But basically, dandruff and dry flags and dandruff and dead skin cells are basically the same. Mm.
Okay, thank you, Sister Noain, for that question. Next, from Prince Suparat. Is it true that we need to trim our hair regularly? If yes, what are actually the benefits behind it?
The benefits of trimming your hair regularly basically is when you trim your hair and you just cut off the ends of it, it will benefit for those who have a lot of split ends in their hair.
Mm.
So when you cut off the split ends, basically the hair will be symmetrical lah. But in terms of some people thought that trimming their hair will boost the growth, or it will reduce the hair loss, or will reduce the hair fall.
Mm.
Those are not. If you tend to cut off your hair or trim your hair and then uh, wishing your hair to grow faster, basically it won't cause those things lah. Mm.
Okay, so now we know. All right, next we have from Sister Najwa. How to reduce the growth
The growth.
of white hair? Oh,
Okay.
stress me.
Unfortunately, white hair, currently there are no treatments for white hair or graying hair. The only solution to reduce white hair is to color it, or you
Mm.
you inai or dye your hair. That's the currently, unfortunately, those are the only solution for graying or white hair. So the cause for white hair or graying hair, um, mostly is due to genetics. So basically,
Oh.
if you have the genetics of premature, if you get early, if you get graying hair or white hair in early age, that could be because of your genetics lah. So there's no treatment for that. The only solution is to color your hair. Mm. There's no treatment to reduce the growth of white hair as well. You cannot prevent it.
Must live with it.
Yeah, basically you can just color it.
All right,
Okay.
next we have from Sister Raha. Is it better to let our hair dry naturally or use hair dryer? Oh, this is a struggle, especially for us
Yeah,
hijabi.
exactly. I would suggest to, of course, it will be better to dry the hair naturally, because hair dryer, the heat from hair dryer, it can let your cuticles open. So it will cause, can increase heat damage to the hair shaft. It can give damage to your cuticles as well, causing long term effect. For example, damage to the cuticles, drier
Mm.
hair, increase in hair porosity, things like that. So of course it will be better to dry your hair naturally. But nowadays I'll find um, modern hair dryer is not as damaging, or
Yes,
as
they have
compared to,
the cooling
yeah,
thing. Yeah.
exactly. I don't think that's a problem. Compared to traditional older hair dryer types, it tends to be um, more damaging compared to the current hair dryer that we have in market. Mm.
All right. I hope that answers your question. Next we have from Sister Ayu. Which shampoo are best suited for growth of hair? I think this is something we all would want to know also.
Yeah, basically, unfortunately, if you see any shampoo and they market the shampoo as anti-hair loss shampoo or hair growth booster
Mm.
shampoo, things like that, I don't think it works. Why?
Oh
Because
no.
yeah, because shampoo, you just leave it, apply it on your hair and your scalp for a few minutes. So it is very unlikely for those ingredients to give effect to the
Mm.
hair, to the hair follicles. But if you want something to grow to your hair, you should find um any leave-on treatments, for example, hair serums or certain hair
Mm.
tonics. Um, if you ask me what is the best thing to grow your hair, the only medication or the only product that will be very effective now is minoxidil. But minoxidil, you need to find it in the pharmacy. Basically, it's a medication that will increase the hair growth cycle and reduce hair fall. Mm. But shampoo, I don't think so.
All right. So now we know not to trust those products that claim they can make us grow better and more hair. All right.
Mm.
Now we have from Sister Nur Hidayah. Is it okay to consume supplements to make our hair grow faster, or will it disturb our hair growth?
Supplement to make our hair grow faster. Um, Supplement, okay. Nowadays the current market, right? If you see any hair supplements, it depends on the ingredients. If the most of hair vitamins or hair supplements, it contains vitamins, for example, biotin, zinc, iron, things like that. All those supplements actually, uh, it it helps in strengthening your hair shaft, your hair keratin. It reduces the inflammation in the scalp. However, will it make your hair grow faster or
Faster.
increase the density? Um, it depends on the ingredient. If it is just a supplement and vitamins, I don't think so. The only things that can increase the hair growth is medications. For example, minoxidil, certain medications, um, but it won't will it disturb our hair growth. If you want your hair to grow faster, basically you need to do something with the hair cycle lah. Uh,
Mm.
so basically, if you want your hair to grow faster, there's one phase in our hair cycle that needs to be lengthened so that the hair will grow faster, longer, and won't fall out. Will it disturb our hair growth? Uh, if you want your hair to grow faster, then uh, it won't disturb your hair growth lah. Basically, but you need to adjust the hair cycle. Mm.
All right. So be careful in buying any supplements out there. Don't
Yeah,
have any
basically,
false hopes.
if you want to buy any supplements, make sure it's KKM approved. Mm.
Okay, all right. And then I think this will be our last question for tonight. I think it's from Sister Afifa. Where is Dr. Shah Hair Clinic located? They want to see
Okay.
you now, Dr. Dina.
Okay. Our clinic is located. We have few branches. Our main branch is in Subang Jaya, SS15. Um, Other branches, we have branches also in Kuantan, in Penang, Bukit Mertajam, and JB Johor. If you like to see us, you can search our IG or Facebook. There will be our telephone numbers over there. You can make appointments. If you would like to visit us, you are very much welcome. Hmm.
Currently, where are you based at?
I'm in Subang Jaya, but sometimes I travel to JB as well.
I see. Oh, I'm from
Mm.
JB. I'm currently in
Oh,
JB right now.
I see.
Okay, all right. I think that's all for the questions we have tonight. Thank you very much to everyone who have posted their questions. Sorry if your question did not get popped up here, but I think Dr. Dina did make a lot of extensive explanation on the things that we need to really think about and care about, especially when it comes to what we want to consume and what we want to put on our hair and our scalp. And I hope that everyone here has learned a new information and get some knowledge on how to be a better, not only a better shopper or consumer, but also better at managing and taking care of ourselves. And for that, thank you again, Dr. Dina. We are truly
Thank
grateful.
you.
She just, she have just finished her work and went home to get prepared and came straight right here just to share all this information with us. So thank you very much for that. We're truly grateful. And thank you so
Thank
much to
you.
all the viewers as well. Don't forget to fill in the attendance form in the chat box where you can get your star points if you want. And if you haven't seen it, you can request to any of the MRCs and they will uh, assist you on that. All right, everyone. I think that is all for tonight. Thank you so much. Have a good weekend. Bye. Assalamualaikum.
Salam.